Respected Chairperson, learned audience, very good morning. And I am Dr Md Shahadat, going to present my presentation. My title is Mavacamtan is a magic drug for HOCM or experience in a 13 years deaf and dumb girl. Hypertrophic cardiomyopathy alters heart function with characteristic hypercontraction, impaired relaxation, and reduced compliance. It is a life-changing disease resulting in impaired functionality and lower overall well-being. HCM is caused by dysfunction in the sarcomere, which is commonly due to the genetic mutation in the sarcomere. It is most often caused by the abnormal genes in the heart muscle. These genes cause the walls of the heart muscle to become thicker than the normal. It is usually two types, obstructive and non-obstructive, but the common is the obstructive HCM. The hypertrophic cardiomyopathy usually occurs due to the dysfunction in the sarcomere protein, which causes the hypercontractility, impaired relaxation, disorder sarcomere, cardiac tissue stiffness, and usually the interstitial fibrosis. The treatment option for the obstructive HCM, this is the lifestyle changes, medication, surgically implanted, and finally the surgery. This is the protocol for the assessment and treatment of the left ventricular outflow obstruction. If the LVOT obstruction gradient is more than 50 millimeter of mercury, then we go for the LVOT management. Otherwise, if the patient is asymptomatic, repeat echocardiography. If the symptomatic, then we will assess for the stress echocardiogram. If it is more than LVOT 50 millimeter, so we go for the LVOT management. It is the resting or provocable LVOT 50 or more than 50. If patient is asymptomatic, go for the beta blocker or verapamil. If he is symptomatic, then beta blocker. If it's still the symptomatic or contraindication of the beta blocker, then we go for the verapamil or diltiazem. And it's still the symptomatic, go for the Mavacamtan. This is the highlight for the drugs. And medical treatment, the cardiac medical treatment of the left ventricular outflow tract obstruction by the Mavacamtan. It is a class 2A indication. And this is for the septal reduction therapy. If the 50 millimeter mercury NOH class 3 or 4, then it is a class 1 indication. So, what are the new hope for the obstructive cardiomyopathy? This is the Mavacamtan is the first and only FDA approved medication for the improving functional capacity and symptoms. This is the mechanism of action which especially causes the myosin side chains inhibitor. To trial, it is the Explore HCM trial and Valor trial. Valor HCM trial confirm the treatment protocol for the HCM. And Valor HCM trial shows there is a 91% had not proceeded with septal reduction therapy and no longer meet the criteria for the septal reduction therapy. This is the treatment protocol for the starting of the Mavacamtan, especially if the LV ejection fraction is 55% or more and the LVOT gradient is less than 20, we go for the 2.5 milligram once daily, and again the follow-up after 4 weeks, and finally follow-up again after the 12 weeks. So, what is my patient? She is a 13 years old deaf and dumb girl. Her father died due to sudden cardiac death. History of the exertional breathlessness, especially during the playing. On beta blocker for the last 6 months. This is her ECG. It shows the left ventricular hypertrophy and left axis deviation. This is her X-ray findings. And this is first echocardiography I had done in 2nd February 2024. Had shows that the asymmetrical septal hypertrophy, the septal thickness is average 21 millimeter. There was an increase the LVOT gradient, and we also show the strain of this patient. Strain shows the reduce the global longitudinal strain. It was less than 11.5%, and the LVOT gradient was at that moment about 126. After starting the Mavacamtan, as this girl was already on the beta blocker, we started the Mavacamtan 2.5 milligram daily dose and follow up after 1 month, and shows this is the after 1 month we did the March 6, 2004. Here looks that still there is a LVOT gradient is high, and average LVOT gradient in that moment was about 65 millimeter of mercury, but it was significantly reduced after starting the Mavacamtan and after 4 weeks of therapy. So what we done after 1 month, 1 month therapy of again we continue the drugs 2.5 milligram and see that there is a excellent improvement of the LVOT gradient. The reduction of it is average 22 millimeter of mercury when I had seen this patient in this month 15 April. So, what is the importance of the hypertrophic cardiomyopathy? Is one of the most common cause of the cardiomyopathy presenting during the childhood. It is the Majority have good childhood outcome with reported 5-year survival rate about 80. The prevalence of childhood hypertrophic is estimated 3 in 1 lakh childbirth. Childhood onset disease is associated with considerable lifelong morbidity and mortality, including the higher sudden cardiac death rate during the childhood than in adult. Heart failure related death are associated for the majority of the mortality in infancy, whereas sudden cardiac death is most common cause of death outside of the infancy. What is my future plan for this patient? Genetic testing of this girl and other first degree relatives, endocrine biopsy and cardiac MRI. This type of study is already going on in the USA. The study is evaluation of the Mavacamtan in adolescent with symptomatic obstructive hypertrophic cardiomyopathy. The duration will be in at 2028. So the take-home message is cardiac myosin inhibitor should be considered in patients with HCM and LVOT who remain symptomatic despite optical medical therapy. It is a 2-area indication. Mavacamtan is the first-in-class drug targeting the key underlying molecular mechanism of cardiomyocyte hypocontracting in HCM. Seems to be useful drug for the full spectrum of HCM present. Thank you. Thank you all.
Thank you for wonderful talk regarding Mavacamtan. Now the question from chairperson.
You have presented Mavacamtan as a magical drug, and it reduces the left ventricular outflow obstruction. We know that HOCM is associated with hypercontractility, and at the same time there is reduced compliance and stiffness. Does this drug work on both the ways, or and how? Both the fields.
Thank you, sir. Especially in the Baylor HCM trial, they've seen that the Mavacamtan also is work as a myosin side chains inhibitor. So it looks that it also reduce the LVOT gradient and also reduce the stiffness also. The long-term study shows that.
Thank you. I have a question. Usually, it's standard practice to check the ejection fraction after you start Mavacamtan on a regular basis and change your strategy if there is significant reduction in ejection fraction. Did you check them and did you report them?
Sir, one of the main indication is if the ejection fraction is more than 55%, then we can start the drugs. And we follow up every month of this patient, and all the times the ejection fraction is good, at least more than 60%. And we observe the LVOT gradient; it is excellently reduced that dose.
Yeah, so you needed to show that in the
sir. We show yes, sir. Sorry, sir.
Dr. Tuhin, whether we can use it in non-obstructive varieties, number one. Number two, there is something REMS program is there, that is risk evaluation and mitigation strategy. Risk evaluation and mitigation strategy. So whether you are following that. So two questions, whether we can use a non-obstructive varieties or apical variety, and then about your REMS program. Thank you.
Sir, especially it is mainly indicated for the obstructive hypertrophic cardiomyopathy. Especially you see that the Baylor HCM trial shows that this is working a lot. But there is some trial is going on where Mavacamtan may be used the non-obstructive variety also, sir.
So is there any role of some patient we are getting like mid cavity obstruction? So is there any role of Mavacamtan in
I had seen lots of literature. There is nothing say about the mid cavity obstruction, especially the drugs. All the major true trial works on the LVOT obstruction.
Thank you.
You just only follow up the gradient, decrease the gradient. Other important part of the follow up, what will be there?
Sir, actually, I want to show the LVOT gradient, but when I do the echocardiography, I assess everything in the subsequent follow-up. But due to the time consuming, I want to show the LVOT, my result only. But all the case, the LV ejection fraction is very important. And I follow up that. I already
LV ejection fraction and also LV dimension.
LV dimension is very
because there is a chance of heart failure as well.
Yes, sir.
Minimal
that may cause the heart failure. Sir, the side effect of Mavacamtan is very low, just some dizziness, headache. Yes, sir. Thank you so much.
Thank you so much. I would like to call upon next speaker, Mohammad Abu Jafar Mohammad Tariq Morshed. He will talk on relation between preoperative plasma fibrinogen level
and post-operative bleeding following off-pump coronary artery bypass surgery.